So the cervical physical exam for Paul, we'll start, what positive for him is his forward flexion was very painful, extension very painful. He didn't have any occipital tenderness on palpation. His Lermetz sign was negative, and that's the flexing of the chin to the chest. With that, that does stretch the posterior and bulges the disc out posterior in the cervical area. Would be indicative of radicular symptoms for posterior disc or osteophytes. And with that movement, if he did have any electrical tingling, that could be a sign of cervical myelopathy. He also had a negative Sperling's test, which is the patient just lateral to what's comfortable, then downward pressure. That was negative also for Paul on left and right. With the Sperling's test, that is trying to load the facet joints and seeing if you have pain that usually should be localized to the neck with the facets. If they do get a radicular symptom with that going down the arms, that could be something doing with the cervical disc. His facet loading was also negative, usually just pressing down on that test. The most significant for Paul was his very limited range of motion. He did have normal forward flexion, but coming back was only at 5 degrees. Normal for his age would be 60 degrees. His lateral left and right was also very diminished with only 15 degrees either way. Normal for his age would be about 45, so more to about that position. Rotation was normal to the right, so all the way chin to chest, but very limited to the left. Only 20 degrees was lateral rotation. And probably most significant for Paul was the multiple trigger points that he had with palpitation. He had several in his trapezius, the large muscle in our back, up into our shoulder and lower neck, kind of the outer covering muscle with lateral upper and middle trapezius trigger points. Also bilateral levator scapulae coming off the tip of your scapula up into the neck, bilateral there. He had trigger points, tender spots, very taut muscle, bilateral splenianus, which is a little bit more inside, lateral also to the scapula, bilateral infrascapular, so just underneath the scapular spine, bilaterally, rhomboids down the middle, also trigger points, and then multiple in the cervical thoracic multifidus, so the small muscles close inside to the spinal processes, all the way down into the mid-back for Paul. He did have some new complaints of trigger points that he's recognized, and these newer ones were down in the lower thorax, and that was bilateral, paraspinal, so down in this area, and then also significant anterior in his pec major were trigger points.